action.
All right. Hello, ED nurses. Today we're going to set up the baby warmer. So a couple things. One, you want to make sure you plug in your air and your oxygen from the machine. So we already have the air hooked in. Just plug in your oxygen there. Then you're going to turn it on. There's an on switch in the back, on switch at the top, and in the middle here. And then we're going to flick on for the suction and for the oxygen. For your suction, make sure it's turned on here, and you want to check the suction to make sure it's at the right interval. So we have your suction coming up from the canister at the bottom. Hook it up to your syringe that you like, but to test, just press here, and ideally between 80 and 100 is perfect for the little one. And then also make sure you have the correct catheter size. So a couple things for suctioning. Ideally, bulb syringe is going to be priority, but otherwise you can use the DeLee syringe. We have these in our green labor and delivery bag, but we will have some also underneath the warmer too. This is a 10 French size, so 10 French is ideal. And then moving along to oxygen, make sure you have it set at 10 liters and 21%. And then your oxygen's going to hook up here to your ambu. Just test it, make sure that there's no leak. So you're going to press here, let it fill. And then you're going to squeeze, and you want the PIP and PEEP to range between 5 and 25. So max when you squeeze should be about 25, and it should start about 5. Make sure that you have different size masks depending on the size of the baby. And then in addition, make sure you have your cardiac monitor here. So the little baby one, we do carry the cord and the attachment right underneath the warmer here, and just plug it into the module here in the trauma bay closest to the warmer. Make sure you have your pulse oximeter for the little one as well, hooked up to the module. And then in addition, have a bunch of towels, warm blankets on here for the baby. You have your temperature probe that hooks in there. The little part comes off, and then put it on the baby's skin and part on top to keep it secure to the baby. When you admit baby here, make sure that it is set on baby mode. Silence button is a good feature as well. Make sure the temp set is set at least at 36.5, and then you can start your APGAR score as soon as the baby is out. Go ahead and hit your timer, and it will be when you're ready to do your first APGAR. And then have a hat to keep the baby warm as well. And then a full syringe, like I said, mouth before nose, and that's pretty much it.